Let's talk about Addison's and Cushing's disease, the conditions that happen when our hormones go haywire.
Central to the underlying causes of these conditions are steroid hormones. The adrenal cortex, located above our kidneys, releases steroid hormones, known as corticosteroids, cortisol, aldosterone, and sex hormones, or think the 3 S's, sugar, salt, and sex, for steroids. The aldosterone helps regulate blood pressure, aids in sodium retention, and the secretion of potassium. Cortisol, known as a stress hormone, helps our body deal with stress, regulates blood glucose and electrolytes, and breaks down fats, proteins, carbs. It's also in conjunction with adrenaline and is our fight or flight response. It's important to remember the function of these hormones to easily understand the symptoms of Addison's and Cushing's. Let's discuss Addison's. Addison's disease is the result of a hormone shortage and can be caused by an autoimmune disorder, infection, or trauma resulting in injury to the adrenal gland. Patients with this condition have an elevated potassium level and are not salty. Just like this happy banana I portrayed, it's happy, not salty. Also, it gets ripe and it gets that hyperpigmentation that you get with Addison's. To remember Addison's, think of the first 3 letters. Add. Due to low secretion or hyposecretion of the steroid hormone cortisol and aldosterone, you need to add more. To remember the other signs and symptoms of Addison's, think of low steroid. You get low blood pressure, you get that odd skin pigmentation that you get with Addison's, or I like to think of even add the sun, like you're tanning, weakness, sodium low or hyponatremia, you get overall fatigue and being tired, electrolyte imbalances, you get high potassium and low sodium. You can get reproductive changes, your irregular periods, erectile dysfunction, or even amenorrhea. Oral salt cravings, keep those potato chips nearby, insufficient sugar levels, or that hypoglycemia. You could even have diarrhea and depression. The complete opposite is Cushing's, an inside source that results in elevated cortisol level. This could be from a tumor in the pituitary gland that causes the body to produce too much cortisol, but more commonly, Cushing's disease is just often caused by a prolonged steroid use. To remember the hormone involved, Cushing starts with the letter C, which stands for cortisol, because it only deals with increased levels of cortisol. Aldosterone really has nothing to do with it. And also, I think of Cushing, or travel neck pillows, the U-shaped ones that we use in buses or planes. They hug the back of the neck and the cheeks, and since they are giant cushions, their bones are less sturdy and have osteoporosis. Patients are also hairy or deal with hirsutism. To remember the other signs of symptoms of Cushing's disease, think of high cortisol. You're going to get hypertension, irregular menstruation, or amenorrhea. Our glucose is going to be elevated. We could deal with that hypernatremia or high sodium. We're going to expect that central weight gain or android obesity, round face, like the moon face. They have very thin extremities, infection rates increase, stretch marks or striae are found throughout the abdomen and on the shoulders. We're going to have that ominous bruising and our low bone density.
Thanks for watching. If you found this video useful, don't forget to like, share, and subscribe for more medical information, and to really help you on your next exam.